What is pelvic inflammatory disease or inflammation of female reproductive organs? I am Dr. Nadeem Sajjad Raja. Pelvic inflammatory disease or PID is an infection and inflammation of the uterus, ovaries, and other female reproductive organs. PID causes scarring in reproductive organs, which leads to infertility, ectopic pregnancy, pelvic pain, abscesses, and other serious problems. It is considered as one of the main causes of infertility. A few group of people are at greater risk of suffering with PID. For example, sexually active and younger than 25, have more than one sex partner, using douche, had an sexually transmitted infection or STI, had PID before, unsafe sexual habits. So what causes pelvic inflammatory disease? Several types of bacteria, mainly from sexually transmitted disease, cause this disease, but two important organisms are chlamydia and Neisseria gonorrhea. But bacteria from patient's own vagina, from own body, can cause, especially from gut, this infection. There are several ways women can get PID. The most common way is by having sex with a person who has an STI. These diseases are carried in the semen and other blood fluids of infected people. During sexual contact, the germs spread to the woman's cervix. The germs can also infect the glands at the opening of the vagina, the urethra, passageway for urine, or the anus. Other possible routes of getting this infection is PID can occur after the cervix is treated due to an abnormal pap smear or after the insertion of an intrauterine device into vagina. However, that is uncommon. Rarely PID can occur as a result of giving birth or having a miscarriage, abortion, or procedure to take a sample from the inside of the womb for laboratory testing. What are the symptoms of pelvic inflammatory disease? Some women do not experience symptoms. Others have pain in the lower abdomen, fever, smelly vaginal discharge, irregular bleeding, and pain during intercourse or urination. Doctors diagnose PID with a physical examination, lab tests, and imaging tests. Antibiotics can cure PID. Early treatment is important. You should or you must promptly see a doctor if you think you or your sex partner have or were exposed to an STI. Promptly see a doctor if you have any genital symptoms, such as an unusual sore, a smelly discharge, burning when peeing, or bleeding between periods. Get a test for chlamydia and gonorrhea every year if you are sexually active and younger than 25 years of age. Have an honest and open talk with your healthcare provider if you are sexually active and ask whether you should be tested for other STIs. So how pelvic inflammatory disease is diagnosed? Several tests are done to diagnose PID. The doctor will take medical history, symptoms, and will do examination. The doctor will take swab from the area for sexually transmitted infections, urine for urinary tract infection because it also causes pain in abdomen, ultrasound or other imaging. So what is the treatment for pelvic inflammatory disease? The sooner your PID is treated, the better. The longer PID is left untreated, the more damage it can cause, and the more likely there will be more complications. Usually 2 or more antibiotics are given. Take antibiotics as per the advice of your doctor. So how you can prevent pelvic inflammatory disease? PID can be prevented in the same way as STIs are prevented. The only way to avoid an STI is do not have vaginal, oral or anal sex. If you are sexually active, then use condoms, get tested, limit sexual partners, not abusing alcohol, drugs, not do douching, remain monogamous. Partner should be treated in case of sexually transmitted infection. Thank you very much for watching this video.